So, as he said, in celebration of Black History Month, we're going to spend a few minutes going over some pediatricians, Black pediatricians that have made a difference and inspired me and others, and hopefully will inspire you as well. So just let me know if you can't hear or some things are not coming through well. But we're going to start out with Dr. Marilyn Hughes Gaston. I don't know whether anyone else in the audience knows who this is, but she is really respected pediatrician in the field. She was the first African-American woman to direct a public health service bureau, and she established protocols for routine screening of sickle cell disease. Now, this may not seem groundbreaking to you, but for us who have had to take care of kids with sickle cell disease, this was a very important addition to our field. And so she started off humble beginnings. She was born in 1939 in Cincinnati, Ohio. She graduated from Miami University in 1960 and studied zoology. And she went to med school at the University of Cincinnati. She was one of only 6 women at the time in med school. And she did her internship at Philadelphia General Hospital and her residency at Children's Hospital Medical Center. So what inspired her to actually go into the field of medicine? Well, this is a quote from her. Apparently, there was one day where in the living room, her mother fainted and she had no idea what was going wrong with her. She was very frightened. There was no 911 at that time, so there was really no one to call to help her. And at the end of the day, they found out that she had cervical cancer. And at that time, she was poor, uninsured, not really getting health care. And that's probably, complications of her cancer led to her actually passing out and having that syncopal event. But she knew at that point that she really wanted to be in the center of making change from a healthcare perspective. And so not many of us have these profound stories, but this was her story, and that's what led her to go into medicine. And so actually, there was another event that really made a difference in her career trajectory as well. So while she was an intern, she admitted a baby with a swollen hand. And now I know I guess you guys are pre-med or med students. You'll learn that for anything you see, you have to have a long differential, and then you sort of narrow down to what you think is actually going on with the patient. And so she had her differential, but she didn't think about sickle cell disease until her supervisor resident mentioned that to her. And that really frustrated her. She wanted to have known from the beginning that this is what the kid had. And I know all of us have frustrations, and some people deal with frustrations differently, but her way of dealing with it was to learn more, to learn everything she knew about the disease. And because of that, she really changed the field. So she secured several federal grants to study sickle cell disease in children. And as I mentioned earlier, established those protocols that have led to routine screening of this disease. And then she went on to join the NIH as a medical expert in sickle cell disease, and then later became a branch chief. She's published several papers on this disease, including one in 1986 that showed the results of a national study that have led to us using penicillin as a way to treat children with sickle cell disease to prevent septic infections. So again, really big deal in this field. She later on went to become the director of the Bureau of Primary Healthcare, the U.S. Health Resources and Services Administration. And she's earned, deservedly so, many awards, including National Medical Association's Scroll of Merit, the Lifetime Achievement Award. She has a day named after her in Cincinnati and in Lincoln Heights, Ohio. And she also has a scholars program named after her at the University of Cincinnati that gives full scholarships to underprivileged minority students. This is the first example that I wanted to take you through. The next person is Dr. Elders, Joycelyn Elders. She's known for being the first African-American woman to serve as a Surgeon General of the United States. So no small feat. Before that, she was the first person in the state of Arkansas to be board certified in pediatric endocrinology. So not just first African-American person, but the first person in the state of Arkansas. So again, she was born as Minnie Lee Jones. She changed her name later to Joycelyn Elders in Shaw, Arkansas. Graduated from Philander Smith College. She studied biology. And she initially wanted to be a lab technician, but again, as you saw in the previous example, something inspired her to go into medicine. And in her case, it was listening to a talk by Edith Irby Jones, who was the first African-American woman to attend the University of Arkansas Medical School. So not just the first African-American woman, I should say, but the first African-American, period, to attend that medical school. So inspired by this, she joined the Army initially as a physical therapist, but then went on to attend the University of Arkansas Medical School. She did her internship at the University of Minnesota and then her residency at University of Arkansas Medical Center. She became the assistant professor of pediatrics at the University of Minnesota in 1971, and then became full professor. Actually, this is 1976, not 67. But again, that's impressive. In 5 years, she went from being an assistant professor to a full professor. And if you go into academia, you'll know why that's no small feat. And some in the audience know what I'm talking about. Dr. She knows what I'm talking about. It's not easy to become a professor, but she did that in 5 years, published over 100 papers. And her main sort of interest or passion was in advocating sex and reproductive education, especially among African Americans. So she was appointed to be the director of the Arkansas Department of Health in 1987 by Bill Clinton. And as in that position, she lobbied for K to 12 curriculum that included sex education, substance abuse prevention, and programs to promote self-esteem. And I'm not sure if anyone's from Arkansas. As you'll know, it's a very conservative state. And so that, again, was no small feat to accomplish that. And then she went on to become the U.S. Surgeon General in 1993, which is a really big deal. So I wanted to mix it up a little bit. Go ahead.
I was just going to say, so she actually was so when I helped to revamp or restart my Black Pre-Med Society at Northwestern University in 1997, our first guest speaker was Dr. Jocelyn Elders. So I actually got a chance to meet her in a very similar setting at the African American Student Affairs building on campus, just like we're doing now in the Black Cultural Center at University of Utah. So, and that was over 20 years ago. That's 25 years ago when I met her, and she spoke to students just like yourself right now. Sorry, go on.
No, that's incredible. If Dr. Ferguson was a pediatrician, he'd be up here as well, and I could tell that story to you. But he didn't go into pediatrics. That was his mistake. So the next person is Dr. Roland Scott, and he really is an inspiration for me, and you'll learn why in a little bit. But he again, these are sort of highlights. He pioneered work in sickle cell disease. He was the first African American to pass the pediatric board exam. And then he was a recipient of the Jacobi Award from the American Academy of Pediatrics. So he was born in 1909 in Houston, Texas. He went to Harvard University and received his bachelor's of medical degree from there. Then went on to do his internship at Kansas City General Hospital and then pediatric residency at Providence Hospital. So he was a professor of pediatrics at Harvard. He chaired the department from 1949 to 1972. And remarkably, I mean, again, if you go into academics, you'll know that it's not, it's very busy. But he somehow found time after his regular work hours to provide private practice hours to treat children from underserved communities who didn't have access to healthcare because of the policies at the time. So great work that he did back then. He published a report in the incidence of red cell sickling in newborns in 1948 and published over 280 papers in this field. So again, no small feat. He led physicians to lobby Congress to pass the Sickle Cell Anemia Control Act of 1971, which led to funding for research and treatment of sickle cell disease. And then he opened a center for sickle cell disease at Howard University in 1972. And as I mentioned before, he received this Jacobi Award for his pioneer work in sickle cell disease. Now, the reason why you may have heard of him as well is that even though he passed his pediatric board exams in 1934, he was denied membership into the AAP on multiple occasions, but was finally admitted in 1945. Now, if you've never heard of him, you may have heard of him last 2 years ago, following the death of George Floyd. The American Academy of Pediatrics finally apologized to Dr. Scott and another doctor called Dr. DeGrasse Smith for essentially denying them access, well-deserved membership in the Academy of Pediatrics in 1934. So again, we may take a lot of things for granted today, but back then, these were things that were not taken for granted, and people had to fight to gain membership into associations that they were fully well-deserved to be a part of. So I wanted to share some more contemporary examples as well. So Dr. David Nichols, he's the former president and CEO of the American Board of Pediatrics and was the inaugural recipient of an award named after him for his work in health equity. So he was born in Virginia. He had a little bit of a different sort of upbringing. He moved to West Berlin, spent a lot of time growing up there. Came back to the US, graduated from Yale with a degree in molecular biophysics and biochemistry. Did med school at Mount Sinai and his internship and residency at Children's Hospital of Philadelphia. And also gained an MBA from Johns Hopkins University, Carey Business School. He was a pediatric intensivist at Hopkins for 30 years, led the department, the division of pediatric intensive care, and also was vice dean for education. But as I mentioned before, some of his notable achievements was being president and CEO of the American Board of Pediatrics. So this is the governing body that grants certifications, board certifications to pediatricians after they pass their exams and finish their residency training. And while he was in this position, he was committed to embedding diversity, equity, and inclusion into the work of the APB, and also led to a lot of innovations in how pediatricians maintain their certification. As I mentioned, he received that award for his work in equity. So he's done a really good job in that position. Again, someone that is closer to our age, Dr. Nadine Burke Harris. She's the first Surgeon General of California. She was born in Vancouver and then lived briefly in Jamaica before coming back to the US at the age of 4. Got her bachelor's from University of California, Berkeley, medical degree from UC Davis, and then did her pediatric residency at Stanford. Did a master's degree in public health at Harvard School of Public Health. And this is what sort of led her to where she is right now. So she was in high school, and her aunt took her to a Black Women in Medicine conference. So again, this is why it's important to come to events like that you are in right now, because there's a lot of people that can inspire you to achieve greatness in your life. And when she was there, she didn't expect to see so many people there, Black female physicians, and of course she saw a room filled with them. That really inspired her to go into medicine. So she was committed to ending health disparities in San Francisco. She created this. She was one of the founding physicians of the Child Health Center in San Francisco and created the Center for Youth Wellness. And there, their main philosophy or goal was to improve child and adolescent health by targeting the effects of adverse childhood experiences. And I won't go through all of this, but she received several awards and became the Surgeon General of California in 2019. Again, first person to be that in that role. So really big deal. And the last person I want to talk about isn't really a pediatrician, but he's someone that has been really instrumental to what I do as a pediatric cardiologist. And this is Vivian Thomas. I'm not sure if anyone has heard about him. His story was sort of documented in a movie. I forget the name of the movie now, but he was Mos Def was acted as it was the actor that portrayed him in that movie. If anyone remembers the name, you can share with everyone else in the group. It's a good movie. What did you
So
say?
actually, so I'm trying to remember the name of it as well. So we were required to watch it in business school.
Yeah.
And actually, yeah, I ended up watching it. I can't remember, but it happened all at Hopkins, right? And he eventually got honored with like a picture of himself at Hopkins. And he was working with one of the cardiothoracic surgeons there for a long period of time. Yeah, I'll have to look it up.
Yeah.
Something the Lord made, or something that's Lord made, I think. Something like that.
That sounds right. It's a good movie. I think you should, if anyone wants to, if you have any free time, you can try to find that.
You can watch it on YouTube.
Go ahead.
Oh, you can find it on YouTube.
Something.
Oh, really? Okay. Well, there you go.
Yeah, it's so good.
But he's very instrumental to what I do as a pediatric cardiologist, because he was instrumental in developing the procedure that treats what they used to call blue baby syndrome, basically cyanotic heart disease. And it was initially, you'll hear about it in a second, but the shunt that they created was initially called the Black shunt, but eventually his name has been included. Most people still call it the BT shunt, but it really should be the BTT shunt to include Vivian Thomas's name. So he was born in Louisiana, grew up in Nashville, Tennessee. He initially was a pre-med student, like you guys, in Tennessee, Agriculture and Industrial College, but then had to drop out because of a bank crash. At that time, he lost all his life savings. So he went on to become a laboratory assistant with Dr. Blaylock. That's who Dr. Ferguson was referring to at Vanderbilt. And they eventually moved to Johns Hopkins. So they created a surgical technique to increase pulmonary blood flow in babies, in cyanotic babies. And so it's interesting because initially this technique was used by by Vivian Thomas in treating dogs with cyanotic heart disease, with sort of insufficient pulmonary blood flow. And it was considered a failed experiment at the time until they got to Hopkins and they had this child who was blue. And Dr. Taussig really wanted them to do whatever they could to help that baby. And that's when they used this for the first time in humans. And essentially, I guess the pictures, I had a picture here of Vivian Thomas standing right behind Dr. Blaylock and instructing him what to do. I mean, essentially, he was telling him how to do what he did because he had done it dozens of times compared to Dr. Blaylock, who had only done it once. So he would ask, am I going in the right direction? And he would say, nope, the other way, Dr. Blaylock, and essentially throughout the whole procedure. So he was very instrumental in making this a success. And again, this has been so instrumental in treating a lot of cyanotic heart disease lesions. And these are just a few examples that I put up there. But without this procedure, we wouldn't really have been thinking that rerouting blood flow like he did would lead to increased pulmonary blood flow in these babies. So very instrumental in evolving the field of pediatric cardiology. So I think that's all I have. And these are just a few examples. There's so many other examples that we couldn't fit in. I don't want to take up all the time from Dr. M and Dr.
Yeah, Dr. Binka, whenever we overlap on patients in the hospital sometimes, and whenever I have a cardiac patient who has had a BT shunt, I always change all of it to BTT shunt.
Oh, you do? Good for you.
I support. I'm with you. I'll support the cardiology field that way.
Does it not help with transposition to great vessels?
Well, no, not in that lesion. So transposition, your great arteries are sort of switched. So your pulmonary arteries coming off of your left ventricle, and your aorta is coming off of your right ventricle. So deoxygenated blood is going back to the body, and oxygenated blood is going back to the lungs, and that's an inefficient system. So in that case, you can't create a shunt. I mean, it wouldn't be as effective as switching the arteries to connect to the right ventricle. So that's the operation that you would do in that scenario. You would switch the arteries.